Good morning, everyone. This is the Revised MnCHOICES application launch webinar for Wednesday, May the 10th. Let's go ahead and get started. My name is Teresa Vanderbent. I am with MnCHOICES. I work in training, and the slide in front of you shows all of the MnCHOICES team that many are here today to answer questions for you. This session is being recorded. You heard me say that at the top of the time. We use WebEx audio to listen. You'll use WebEx audio to listen to the session. All of you are muted. Like other webinars, we'll ask you to raise your hand to ask a question, and then we will call you in order that your hand is raised. And when we call on you, we will unmute you. So if you haven't been here and haven't done this before, that's kind of how this works. We'll have sections of agenda items that I'll go through, then there'll be time for questions on those agenda items, then we'll move to the next one, and then there is time for all other questions at the end of the webinar, just for the new mentors who may not have been here before. So we talked about this a little bit at our last launch webinar, and I'm going to keep this acknowledgement and ground rules up just to help us all remember that, you know what, launching a new computer application can be stressful, and it's good just to have some basic ground rules, specifically that we really all want to support an atmosphere of good intentions and respect. That is us and lead agencies and everyone together. We are here at DHS to really help you get the information you need to launch, and then you are here as agency mentors, and really this is your time to learn and ask questions and get the kind of support you need. And so we're coming into this webinar today with that atmosphere of good intentions and respect, here to support you as you move forward. If you do have questions, though, that you feel are policy related, we would ask that you put those on the MnCHOICES help desk form. It's very hard to answer policy questions in a webinar. They take some discussion between several policy leads usually, and they're better answered from the help desk forum than in this webinar. So our objectives for our 2022-2023 launch webinars are really to make sure you understand and you can communicate anything about the release schedule, content management, any changes that you need to your agency. To learn about the tool, the computer application and the tools and how it works and workflow and handoff so that you're comfortable as you get ready to launch. And then after you've launched in this transition period until the other systems are retired. We want to make sure you can apply your knowledge of the application's function to implement a work plan for yourself, that you're able to implement the transition timeline and use the historical documents and system features in your transition, and then to update staff data for access. And we'll talk some more about that again as we get closer to July. So maybe at our next webinar, remind you how that user access works and what that will look like in real time for you at the June webinar. So today's agenda, we are going to talk about the help desk form updates that are coming. We're going to talk a little bit about some help center resources that were recently put in that kind of address some of the questions that you've been asking. And then we're going to review the CBSM page LTSS forms because there are a few changes to titles and other things that we want you to be aware of. And then last but not least, we're going to talk a little bit about the list last communication beta phase and when the release of the new MTZ to all the agencies will occur. So that's kind of our plan for today. If for some reason you do not have the PowerPoint in front of you and you're like, well, where's the PowerPoint for today? Remember to go out to the DSD archive page, click on MnCHOICES, and there is a link to that the PowerPoint that I'm doing right now there so that you're aware. So let's talk a little bit about the help desk form. It needed some updates. It needed some updates because we now will have 3 systems up at one time. You needed to be able to have your questions routed appropriately since there are more policies, policy people connected into the revised MnCHOICES application. And so I just wanted to talk to you a little bit about the changes that are coming in the next week or so, and so that you'll see them, know about them, and not be surprised that they indeed are coming. So let's go ahead and move to this next slide. So we changed the question type a little for the help desk form. So after you kind of fill in your basic information about who you are and submitting that form in, you have 3 options to choose from: technical, policy, or practice, and other. And so the form link on County Link will be updated, or actually the link itself will become the new form because it is a DHS form, so it'll just get updated. And then you'll start here. You'll pick your question type, and we'll talk a little bit in the next slide about what that means. So technical is really the system isn't functioning as expected. And so you'll put the problem, date, and time, and it can be for the MnCHOICES assessment, the MnCHOICES support plan, or for the revised MnCHOICES application. You'll be able to report each of them. And so you'll put the problem, date and time, the form type, and the person ID when you choose technical. And then you'll be able to say which version is it, which of the computer applications are you working with? Just like I said, it'll have all 3. And you'll also then be able to say, is it in training that you're experiencing it, in testing, or in production? So then you'll provide us some other information. Who experienced the problem? Describe the problem. You'll talk about the steps taken before the problem occurred. And please know that this box in particular is very important. The more detailed you can be about, this is the error that I received and here's what I did up, to get to it. Then we can replicate it and test it and see what's going on. If you indeed are putting in a technical, that will help us a bunch. And then if you've tried anything to resolve it, we'd also like to know that. And then there's an opportunity for other comments as well as attachments. And why attachments? It's because you might want to take a screenshot and save that. And that again is useful for us to see the error, to see what you're on when the error occurs. It's just useful to have that more information because, as you guys know, the more detail reduces the back and forth, because I've said this before, we think human communication, we know what each other's thinking, but oftentimes we're coming from totally different places at where we started from. And so the more detail helps us start at the same place. So thanks very much for that. So if you are indicate policy or practice question, then what you're going to see are these options. I won't read through all the lists, but I'll let you look at them for a second. And what you'll see is kind of for every policy group that is kind of inside the MnCHOICES application. You'll see them listed here. You'll also see that MnCHOICES training has been added here. And for other, you can see Moving Home Minnesota and a few other programs as well. So the goal here is to really get to your question, policy question, routed to the right place. So you will also get, how is the question related? Is it related to aging or disability programs? And then you'll get to put in what your question is and any additional information and attachments again, if you have any. And again, if, so for each of those selections, when you choose, sorry, I'm going to go bring it up on my other screen. So if you were to choose home care, I'm just going to put this over so you can see it for a second. So if you were to choose home care, which is this one right here, right? Then what will happen is then this item will come up and it'll ask you, well, which part of home care, PCA, CFS, or CDCS do you have a question about? And then you'll be able to indicate it and then answer kind of the same standard questions that are for each policy. One that you indicate, it'll give you a list of questions. It'll say, what's the policy or practice question? What other information do you want to provide? And what kind of attachments would you like to attach, if any? Then if you click rates policy, then you'll get these buttons for aging or disability services. Again, it'll give you what's the question. Is there any more information you'd like to share? And you can add an attachment. Somehow or another, OBRA 2 got cut off. We have OR 2. So you'll get to choose OBRA 1 or OBRA 2 if you've chosen the OBRA selection. And then again, same kinds of questions. If it's about managed care, you can say whether it's MSHO, MSC Plus, or SNBC. And again, what's your question? And the reason why we have these is because then when you make these choices, they are getting routed to the policy who will answer that question for you. And so there'll be less routing around in the background, us exchanging your question back and forth between each other. The new help desk form will send it directly to the policy group it should be with, which we think is a huge advantage to the changes that we're making. And then there's also one for the LTSS improvement tool. Same thing, same layout as you've heard me talk about before. It'll give you, will ask you what your policy or practice question is, if there's any additional information, as well as attachments. And then we added MnCHOICES training inside with the policy, and we gave you some options that you haven't had before. So you can say, yep, it's a certification question. Hey, I've got a question about how the credentials look in the revised MnCHOICES application. I have a recertification question, or I have just some other training questions I'd like to ask. And so you can indicate them, tell us what your question is, and then provide any other additional information. And again, add an attachment. And you can, in this case, even describe your attachment. So if you think it's going to be confusing about why you sent it, you want to say, hey, this attachment's here because of whatever, that would be great. One of the most common back and forth with training is not providing either the person's full name or their train link ID if we need it for some reason. And so some of those small things, again, can save the back and forth. And then policy other, then you're going to get the ability to pick moving home Minnesota. You'll get to be able to choose Rule 185 or housing stabilization services or other. Sorry about that. And then lastly, there's other, so that if you really aren't sure and you have other questions that you want to ask and you couldn't find them anywhere else, you can then, if you have a question about user access reports and data or other, you can put it here. I anticipate most of your user access questions will go, if for the revised application, you'll be going directly to the SAM team, but maybe for the F1 counties for the MnCHOICES assessment, you can continue to use this to submit your forms in for that system. So that was kind of quick, but I feel like it was kind of basic information, so I didn't want to spend too much time there, but I wanted you to be aware of the changes so that when it occurred, you weren't surprised by it. I'm being told in the next week or two that you'll see these changes go live. They're just fixing a couple of pieces in it, revising a couple of pieces in it before it goes out. So before we go any further, I'm happy to go back and revisit some items because that was kind of quick. But at the same time, we won't spend any more time on this than what you need. So I'm going to give you a moment. If you have a question, feel free to raise your hand and I can back up and show you any slides again, and we can talk through items. So Beth, if there are any questions, please go ahead and call on folks.
I will in a second. I just wanted to reiterate something. I'm just seeing things in the chat. I want to make sure that folks know that this isn't replacing Policy Quest. It's for MnCHOICES related questions that are just going to go out to a broader policy area. It's assisting us with filtering to get you faster answers. And so it's not replacing Policy Quest. I want to be sure about that. And then it's similar to today's form where you're going to, where mentors are filling it out. Teresa, would you add anything to that about who's filling out the form?
Yep. So it should continue to be mentors who are filling out the form. You'll see something at the top of it that says who the mentor is, who they're submitting the form for if there's another person. It'll say on the top something about to be filled out by mentors. And the reason for that is because mentors are the technical experts for your area. We do not want individual people submitting in the help desk forms. It would just make for way too many requests, as well as many agencies have a technical process in place where you support your users, and we don't want to circumvent that. So we're going to stay with only mentors submit the forms to make sure that the processes that you have set in place with our mentor structure continues to work well.
Thanks, Teresa. We have one question from Janine Brotherson. Janine, I'm going to unmute you.
Morning, Janine.
It's an accident. I didn't have a question.
Okay.
Oh, all right.
Sorry.
Thank you. Nope.
This is my. Oh, yeah.
Okay, Teresa, we're good to go forward. Thank you.
Okay. Yeah, I assumed there weren't going to be a lot of questions on it, but it's just good for people to know it's changing. So one of the other items we wanted to talk to you about today is three new items added to the Help Center. They are in both MTZ AWS Help Center and the old MTZ, the one that most folks are using. So you can access them at any time. You can see them on this screen. We're going to walk through a little bit about them, tell you how they're organized, and talk about each of them specifically. So I'm going to go ahead and do that. So these three guidance documents have been added. The first one is the DD screening documents fields. And so we've been hearing you say, gosh, where does the data from MnCHOICES populate into the screening document for this example? And so what I'll show you is for the DD screening document, how this is laid out, and then how it'll show the comparisons. And then we're going to do the same. We're going to talk about the long-term care screening document fields and talk about where they populate from. And then lastly, we're going to look at the MnCHOICES PCA CFSS data and where it populates into the CFSS Type B service agreement and the support plan. So we're going to show you what these docs look like, and then you're welcome to go out to the Help Center for any of those environments that you're in and go out and review them yourselves. So I just wanted to talk to you a little bit about how they're organized. So the DD screening document guidance does a couple of things. So it identifies the fields by the MMIS screen and the field name. So the fields are automatically populated from the data that you entered in the assessment. And so they're here just to say to you, here's where they come from. Here's the field that the MMIS screen is talking about, and this is where it comes from. So you don't have to do anything with them. Oh, so it does not include fields that the assessor has manually added into the DT screening document. It's only the ones that are automatically populated by the assessment. So Beth, would you say anything more about field name? Would you like to say anything more about that? You're welcome to if you'd like.
No, it's pretty straightforward for DD.
Okay.
It's what you're used to seeing, what they're used to seeing. Yep.
Okay, cool, thank you. And then secondly, the other half of the document, the other part of the table, has the assessment section or domain that the score came from, and then the specific assessment group where the score came from. So you'll have that, so it'll identify that. It does not describe the rules used by the application or how the assessor responses affected the results, but at least it tells you kind of, so it comes from here, and this is where that score came from. We know that that's something that you've been wondering about and asking about, and so this document is here to help you understand that as it relates to the DD screening document and the assessment sections, domains, and groups. So just so that to make sure that you're aware of this one, we're pretty sure you are, that some of the information on the DD screening document is populated by multiple sections of the application. And so some questions will only appear when assessor selects a particular response, but you can refer to the DD code book, which is the link here, to better understand the information that's populating into that MnCHOICES DD screening document that we provided you. For the LTC screening document guidance, it's pretty much organized the same way. So what it does is it identifies the fields using the MMIS screen and field names from MMIS. It includes all the fields that are auto-populated, and just like the other one, if you manually added information to the LTC screening document domain, then it of course isn't going to be in here because this only looks at automated fields. And then like the other, it will have the assessment section or domain and the assessment group that the score came from. So this again won't describe the rules about how that was applied or how the assessor responses kind of affected the scoring, but it'll help you to figure out for this MMIS field what assessment section or assessment group helped inform that score. And again, these are just some information for instructions that you can use to understand the screening document and how the information is used and edited in MMIS. So we thought that would be useful to provide that to you. And then note that it also has information, instructions for MSHO and MSC+. These are documents that you've been using all along. So the long-term care screening document will also include if there is a workaround that you need to be aware of, because some of the information in the LTC screening document is populated using information from multiple areas. And if there is a current functionality, if there is a defect that's in the current functionality in an enhancement document, it will note it in it. And so you can go to it and say, oh, yep, I have to go look at the workaround for this field and then determine how to complete it. Again, is there anything else that policy would add to this slide? Have I described it well?
You described it perfectly. Thank you.
Okay, thanks. So the last document is the PCA CFSS Type B service agreement and the support plan. So again, where for that document, here are the MMIS screen field names, numbers, and the field name. And again, all that information is automatically populated. And if you enter anything in manually, again, it won't show up. And then it again says what section or domain is it in? Where did it come from? And so you see in this case, it's coming a little bit from the support plan, mainly from the person profile information. It doesn't describe the rules or how the application applied the information, just like the other one. And again, here's information that you can refer to for guidance about that specific form. And then again, like the LTC, you may see a situation where in a field name, it's going to say to refer to the current functionality document. And so when you see that, then you will know that in that instance, you need to use the workaround. So again, these are really just here in the MnCHOICES Help Center for use to use so that you know where those MMIS fields come from, if you have a question about them, and then also if one may be affected by a defect that requires a workaround, that you're aware of it. I can, you know what, I'll show you can show you where that lives in the,
Trish, can you go back one slide really quick?
yep, happy to.
Thank you.
Do you need me to say anything? Do you need to say anything different about that one?
No, I'm not sure. Kathy, I see that you have something in the chat. If you want to raise your hand, you can ask us your question. I'm not sure if you need to see it more or if you want us to. Okay. I want to unmute Kathy, if that's okay. Hi, Kathy.
Not able to keep up today or what. Hello, everybody. But on slide 35, so we're in CFSS type B service agreement and the support plan. And it says, if noted near the field name in the table, refer to the, so in the table, it will say to consult the document.
It'll have a footnote. Yeah, it will tell you that it's something that you need to go into the current functionality document to see. For PCA specifically, it's looking at 10 hours versus 12 hours of PCA time and whether or not you can do the enhanced rate for EM.
Yeah, so this is the help center for the current MTZ.
Yep.
You can see the documents here. See if I can.
Thank you. I just haven't had time to look at this new one yet.
No, well, no,
it's
we're
in
just
the
letting.
new,
Yeah, we're just letting you know, and it
the new
exists
training zone.
for beta in the AWS as well. And so this is what it looks like. Sorry, I'm looking for the reference.
Oh, good. Yeah.
So see, it's right here. That you can see it right here.
Oh, okay. Thank you. That helps.
Yep, not a problem. That's what I figured. I thought, oh, while Beth was asking you a question, I would go bring it up for you.
Appreciate it.
Yep, no problem. And so that other folks can see then too, you can see them all here. So it's sitting guidance PCA, guidance DD screening document, guidance LTC screening document. So you can see them. That's why we put them in exactly for that screenshot of as we started with the naming convention that they have in Help Center. So you can go there and look at them yourselves when you've got a moment.
Teresa, we don't have any more questions. We can keep going.
Okay, great. So, as all of you know, as we keep moving towards launch, there are some changes that are made. There are some minor changes made to the LTSS forms in the CBSM page. And so you can see this is a screenshot of the CBSM page when you get to it on the landing page. And if you go down on the left-hand navigation to forms and choose LTSS forms, that's the content that I will be speaking to today. Or you can see it on the landing page itself under LTSS forms, CBSM forms for LTS assessments, eligibility, and support planning as a link also. So what the changes are that are on this page are some form titles were updated, and then we added a link to the 6791K, which is that new letter that goes with your documents when you are required by the workaround to make a physical change to a document that you put with it that says, hey, I've made a physical change and DHS is asking me to do that. And so it is that helping them know that it's part of the system versus something that a lead agency staff member chose to do, for example. And then use with MnCHOICES, there's a column that indicates for each of the forms if the document was moved to MnCHOICES and is available in the revised MnCHOICES application, and I'll show you that as well, so you don't have to try to remember this. This page, though, does not address MCO processes, so care coordinators will follow the instructions from their MCO that they work on behalf of. So I just want to make sure I'm clear about that as well. So here are title changes. So I will leave them up for a moment for you to look at. And so what you can see is the form numbers have stayed the same. It's just that the worksheet titles have changed to better describe what the form is about. Just going to leave them up there a minute in case you want to look at them.
So just a note for like the physician certification of level of care form, that wasn't updated. Nothing happened with that form. This document itself in the CDSM just hadn't been updated. So we will, we're just updating it now. We're catching it now. So just to make that clear that you can worry about new forms.
Yeah, because aren't all of
And
these really
then,
about title changes, or are they about more than that?
I'm checking on the AC ones and I'm double checking about those. But I can say for sure that the 7096 wasn't updated. It was just updating the title. And then just so folks know, if you're going out and looking at this today, you're not going to see this update yet. You'll see it. It should be published Monday or early next week. Maybe I'll just say early next week. But it will be published next week. So you won't see it live today.
And so the one form that was added to the list is the 6791K. And like I said, it's the one that says you may notice changes or additions to your MnCHOICES assessment and support plan. This may include. So this document is now there in the list, and this is the document you'll use, your agency will use when there are hand corrections, typed or electronic corrections, or a printed screen from the online MnCHOICES system is what it talks about. And so it has been added to the list as it is a new item that you requested and that DHS then provided. So again, this form will say indicates who should use the form and kind of when they should use it. So, and this is the only form on that list of CBSM forms that includes care coordinators, because there may be changes that you make to your plans or your assessments that require you to put this cover with the document provided to the person. So the other change that you'll see on this form is that, so this is how it's laid out. So it's laid out for kind of each of the form names along the top, and then for each of the, each of the headings along the top, the form name, and then it'll say, yes, you use this form for each of these programs or waivers. And then it will also say at the end, is it used with MnCHOICES? And sometimes you're going to see no, because it's been built into MnCHOICES. And so that's one of the things that you'll notice that will be new about this form or about this CBSM page.
It does say today if it's used with MnCHOICES, but we just added, we'll add some additional information about where in MnCHOICES. So
Okay, thank you.
And I did check the AC forms. The AC forms were updated in January of this year. So we're updating, we're just catching the title change here. So thanks.
Yep, and those announcements usually go out separately as when the forms are updated. This is just making sure that the CBSM page matched everything else. It's kind of one of those, we've got to update it as we're going through and have updated other things to make sure that your reference page that you go to is accurate and reflective of practice going forward. So I don't have anything else for this one. I'm willing to take questions if there are any. Beth, you
We
noted
don't
that
have any questions.
Okay, Beth, you noted that you thought that it would be out by maybe Monday, the update to that page?
It should be early next week, yes.
Okay, yeah. So as you train, maybe next week or the week after, you can go out and look for it. But just so you know kind of what the changes were made and why they were made, and so that you're not like, oh, this changed. What about it changed? So now you have a sense of it. So the last thing I'm going to do is I'm not going to spend a lot of time. I think this is one of the last things. Anyways, I should say last thing unless I know for sure. Is we're going to talk a little bit about this e-list, more from the sense of how they're laid out and how to use them. And so when you get an e-list, it's a really short little condensed version, and it'll say the basic information that you need to know. And then it'll also add a for more information link. So I'm going to back up a second. So one thing I want to make sure that you are aware of is anytime an e-list comes out and it has for more information and it has a link added to it, don't take just reading this as sufficient. Always go and read the full announcement. The reason being is there's, as you'll know from this e-list announcement in particular, there's a lot of stuff in it that isn't on the screen. And so just make sure that you take a moment and read the full information and not just the little blurb that we provide you. So I'm not going to walk through all of the phases, just to say that the phases have indeed been updated and that they go out for quite some time. And so this is the way that the phased launch is been developed. And right now there are folks in beta phase that are using the MTZ AWS training zone, and they are, so basically the new platform for MTZ, and they're going to use it. They've been using it May through June 30, and we're going to talk a little bit about that beta phase as well in this webinar today. So the folks who are in the beta phase group that are first working in the updates to MTZ, that new platform, and then moving to using production a month prior to everyone else are these lead agencies listed on the left of my screen. So they include White Earth Nation, Hennepin County, St. Louis County, Mid-Prairie Alliance, Health Partners, Prime West, and UCare. And for each of these agencies, they have 4 users who are currently in the training zone and training in that kind of first part of the beta phase. The beta phase runs from May 1st to June 30th. The first part of the beta phase is to go into the new MTZ through the end of May, and then they will start using production June 1st to June 30. And the good news for all of you is that you'll use the new MTZ starting June 1. We will send out a communication to you when it is time to start using the new MTZ. It will include a URL. You should also be happy to note that you won't have to change your usernames. You'll just have to add the number # to your passwords when you get there. So it will be easy to make that changeover. But again, that will be in instructions. So as you can see, we're moving forward and closer to the launch. And you will soon be able to be in the new training zone. We know that's something that you've been waiting for, so it's fun to be able to share that news with you. So one of the questions that gets asked is kind of what's new and improved in the MTZ new platform. And basically the roles and permissions have been fixed and updated specifically for offline mode, but there have been other roles and permission fixes. There are additional services and updates to services, so you can plan for more services than the limited that we had available in the current MTZ. It also includes updates to the provider lists, and the following configurable forms will be available. So you'll get to use the CFSS to PCA conversion worksheet. You'll be able to work with the OBRA level 1, as well as the EW customized living and foster care worksheet. So those will all be available to you. So I think that I will leave it there. So from a standpoint of my screens, this is the last question group in relation to the ELIS and the phased in approach to launch. And then after that, we're open for questions in general. So if you have any questions about the E-list that you would like to ask, you could ask them now, and then we will move to more general questions. And then I have a couple of items I could, I've been hearing people have more questions about that I would be happy to address as well. So first of all, any E-list questions?
Teresa, do you want to just go back to the date that the new MTZ will be live for everyone?
Mm-hmm. Happy to. Whoops, I can't highlight it. Huh.
So
So
June 1st.
June 1st. Coming up quickly. And like I said, you'll get an email from us with information. You'll get the new URL and what you need to know.
Okay, Teresa, we don't have any more questions right now.
Okay, then I'm going to go to the any questions. But I'm going to start with a couple that I've heard you ask in the past, and we're going to answer them. And then, so that'll give you a chance to think about any questions that you have. So, sorry, I was getting my screen set up. So I am in MTZ, the current one that most folks are using. And we had a question about the how would I use queries to view my caseload? And so I want to show you. I practiced a little bit with it, so I feel like I could show it to you and have it make a little more sense. So in the navigation header, if you go to queries and you click on it, you can see it says my caseload here, but you can click this button all day long and it isn't going to give you anything. Instead, what you'll do is you'll click run query and then your caseload will come up. So these are all the people that I've been assigned to in my caseload so that you're aware of how to use the caseload query. Another question that I've been having, and it makes a ton of sense that you guys are asking it now, is you've got new assessors that are starting and you're trying to figure out which system you get them certified in. And especially if they're going to use MnCHOICES assessment MNA and then they're going to move into the revised MnCHOICES application. That's where I see the most confusion. So I just thought I would revisit that. I thought that that might be useful to you. So I'm going to go to County Link and I'm going to talk about it in a way that I hope makes sense to you. So the way I want you to think about certification is is the 3 steps, step 1, 2, and 3. And I'm just going to bring up the MnCHOICES assessment MNA certification instructions once. What you know about them is step 1 and 2 are the same for both applications. And how step 3 is organized is they're getting certified in the computer application they're going to be using. So part 1, 2, and 3 are really about things like access and navigation, content in that computer application around assessment, and then workflow in the assessment. And so what you need to think about is this: if they're going to start in the MNA application, then it's my recommendation that they get certified using these instructions, okay? And I'm on the training page. If they're not going to do assessments in MNA, then you would have them certified in this application, or in these instructions, sorry. So that's kind of how your cut is. Where are they going to start their work as a new certified assessor? if you're having them start their work in M&A, but you're like, well, how are they going to learn how to use the revised MnCHOICES application? Then remember we did that training by role document because you were having questions about where they should take their training, where some folks should take their training. I want to show you something. So here's the thing that says existing certified assessors certified in M&A. So if you certify a new assessor in M&A, because they're going to work in it for a little bit, but you also need them to use the revised MnCHOICES application to do assessments a little bit later, then this gives them instructions on where to take their training so that they don't do any kind of, don't have any impact on their certification from a TrainLink data perspective. The other piece I want to remind you of is that all of the step 3 links live in the revised MnCHOICES, or sorry, live in the TrainLink course called MnCHOICES New Mentor Training. And there's a specific module in there where it gives the links and it gives the list of the step 3 links for both the revised MnCHOICES application and M&A, and you just need to select the one, and you can find that on slide 12. You'll hear it in the instructions. Please know the instructions are vague, and the reason why they're a little vague is because, remember, only lead agencies can certify assessors, and we don't want the general public who may have access to TrainLink be able to certify themselves. So they have to go through you have to go through the process of being an employee at a lead agency. And so what you'll see in the directions is this. Important. Have the assessor candidate copy the step 3 link into the browser before logging into TrainLink. Have the assessor candidate, sorry, let's do this piece first. Sorry, I picked the wrong one. So it's going to say to you, hey, refer to the new mentor training. Refer to the module called MnCHOICES Mentor Role for more instructions. And so then it's telling you, okay, if you need the step 3 links, here's where you find them. The other piece where people often get stuck is the hard part is how TrainLink functionality works. So if you give them those links and they click on them, or if they've logged into TrainLink first and you give them a link, that's when they have issues. They can't seem to get into the link. And so this important is here because it tells them before logging in, have them click on the link, then click on the course tab, and then log in, and then it will take them to the course. So we've specifically added these 2 pieces to the instructions to help better inform the process and to make it less clunky for the person, either the mentor in the case of where the heck are those step 3 links, or for the user when they're trying to go from the link that you provided them to TrainLink, but they're having an issue with it. So you could always copy this part of this instruction and provide it to them as well. So with that, I'm going to go back to, do you have any other questions for us today? Because this is indeed the content that we planned on covering. So we want to make sure we have time for your questions.
Teresa, Alyssa Paulson has a question. Alyssa, I'm going to unmute you.
Can you hear me?
We can.
Hey, so this is in regards to kind of the layout for the next year in the revised MnCHOICES application, right? So for context, my specific agency works with 2 different MCOs, and one is a lead agency and one is not. And so I'm just looking for some clarification after reading through the schedule for the next kind of year of what that means, because I don't think I haven't been able to decipher it super well. And my question is, so it seems like only lead agencies will start doing the care coordination assessments and then, start doing more and more throughout the year into spring of 2024. Is that correct?
I'm going to let someone on the MCO side answer the question versus having me try to answer it. to make sure it gets answered correctly. So what you're asking is kind of when do you start your HRA and assessment work in the revised MnCHOICES
Yeah,
application?
it appears that only lead agencies are starting to do that throughout the remainder of the year, and non-lead agencies aren't, but they will have access to training. That's how I'm reading it. So I'm just trying to clarify if that's correct or not.
I think
Yeah.
we just need to define lead agency, and we would include MCOs in that as a lead agency.
Well,
We
I
consider
think
MCOs lead agencies.
I think we're also considering delegates, which is to her point. She's wondering
Yeah.
as a
Yes,
delegate,
yes.
are they included in that language? And I think that that is a language issue in the E-list.
Yeah, so it says, it lists 7 lead agencies. One of them is Health Partners. We work with Health Partners. We also work with Medica, right? And so Medica is listed as a lead agency, Health Partners is listed as a lead agency. So my assumption would be that they would start utilizing that, June 1st, right? And then do that. And then Medica wouldn't start utilizing that
Interesting.
until next spring. Does that make sense?
Yeah, except for Medica should be in there as a lead agency. So I was just going to the E-list. Go for it.
I think it's about the beta group, the slide that you had up about the beta
Oh,
group. That,
yeah.
There's only a small group of people that are in there for the beta group, and those are the folks that are in there now through the end of the month. And then June 1st, everybody is getting access. So you will have access June 1st.
So we'll have access to the training and then access to start doing assessments based
July
on
1st.
July 1st.
July 10th.
Okay.
Oh,
10th.
July,
Okay.
yes.
And then
Yeah, July
that
10th is our launch date.
that will apply, and then before it's released statewide, whatever. But so that's going to apply to both of those. Okay, that clarifies my question. I hope I didn't create more questions for other people.
Thank you.
Yeah, thank you.
Thank
That's
you for
really
asking.
helpful.
Okay, Shelly Hines. Hi,
Yes.
Shelly.
Can you hear me?
We can.
Okay, I'm going back because I actually do have a brand new staff who's in process of doing their MnCHOICES certification.
Yeah.
So my follow-up question to what you just shared was, so my new person will likely need to be doing MnCHOICES assessments in the old and in the new. So
Yep.
we're right at that precipice of deciding which path do I go so that I can, because we're right there right now today.
Yep.
So thank you.
Yeah. So do you have a follow-up question then? Is there still a place where you're
Yeah,
like,
so I guess if
which do
which one
choose?
do I do? Which path do I do? Finish everything
If
in the old?
if they're gonna do both, I would
Yep.
just have them certify in the old system and take the coursework for the other in the new and follow. Sorry, I was looking at this and I can't stand that this for some reason is so small. So I need to make it a little bigger to make it easier for you to see it.
And I have it pulled up actually too, so
Okay. Yeah, so I'd recommend that you have
do
them
that.
take the MnCHOICES assessment for the certification and then just use this training by role table and then just have them take access and navigation, then the content and the workflow. Because if they're going to be doing both assessments at the same time, then yeah, they'll need to know them both. If they're going to move from one to the other, you can maybe stagger when they would take this next group of training based on whatever schedule you work out for how they're going to do their work.
Okay, because this will be an initial certification for this person, so.
Yep, they just need to be certified in one system, but they need to learn the other. And so to me, because we have these 301As and 303As set up, it would be easier to certify in the old system and then just take these courses in the new.
The additional courses in the new.
Yep.
Okay,
That's
that's
my recommendation.
And I know this is a kind of off the topic, but so I took over for someone else. And my only issue is with the old training zone. I don't have record of the IDs that were given to everyone else So are those numbers, user IDs, reusable if somebody's left, or how does
Yes.
that?
Yes, they
Oh,
are reusable.
thank you.
Yep.
I've been searching for that answer, so this was perfect. Now I can give her the link she needs to do to complete her certification. Thank you
Okay.
for
Yep, you're
clarifying.
welcome.
Appreciate it.
Sure.
Okay, Maria, you're up.
So I know that this isn't about anything we've talked about today, but I do have a question. And I'm wondering if there's been any consideration of even removing the requirement to choose the program that the client will be going on prior to opening the support plan, or maybe adding that signature sheet to the assessment part, or even maybe making the program choice editable after the support plan is open. Because I know I brought this up before, but when we go out on an initial assessment or even a PCA reassessment, we don't always know the program they'll be going on, but yet we have to have that signature sheet prepared, because if they're doing PCA, CFSS, we need to obtain those signatures in the field. But if we choose that and then we go out and we do the assessment and it's like, oh gosh, they now need, CADI or some other, waiver, that's not changeable. So we're stuck with it saying that they're doing PCA, but yet now we need to change that.
So,
Yeah,
so
do we work
yeah,
that?
Beth, hang on a sec. So, we have heard that concern, and so know that there will be direction coming out about it.
Okay.
I don't know that we're ready to say any more about that, are we?
no, I was just going to
Policy?
say we've heard you. We
Yep.
really have heard you. We understand what the issue is, and we're looking at what we can do within
Okay.
what we can do, and we'll communicate out more probably in June. So
Yeah.
just give us a little bit more time to
Okay. Because I
There
keep
is
feeling like
figure out
we're
next
running
steps.
out of time.
Yeah, no,
It's got to be
there
ready to
is,
roll
I
in
understand.
July.
yeah, there is internal conversation and working through detail for that for you. So, it is being listened to and taken into
Okay.
account.
Awesome. Thank you.
Yep. Mm-hmm.
Thank you. I am not seeing any more questions.
Just going to give people a few more minutes in case they have ones that they're coming up with.
Remember to raise your hand if you have a question.
And so I'm going to reiterate something that Beth said that I didn't say very well, that is important to note. And that is that, because you've heard me say July 1, but the launch date is July 10th, per the e-list. So that was my mistake. It's correct in your PowerPoint, though, on slide 45. I just want to correct the verbal record. We're just going to give you a few more minutes in case you have any other questions. We assume that you might be talking to each other and formulating if you have any other questions for your agency. If there aren't any, we'll end this call early, and then we will, our next webinar is scheduled for the second Wednesday in June. And we have an office hours on June the 2nd. I just wanted to look it up, make sure that I didn't speak about it off the cuff. So there's also an office hours on June the 2nd. So people are aware. Okay, seeing no other questions, I think we should go ahead and end today's call. I wanted to take a moment and say thank you everyone for attending today. We look forward to office hours June the 2nd and then our next webinar, and you will be receiving information from us about the new platform for MTZ and instructions with the URL and username and password information. So you won't just be what you heard me say verbally, you'll get something in writing as well. And so thanks everyone for attending. Ellen, you can go ahead and end the recording.